I'm Dr. Shoaib, and I need to tell you something that most doctors never get around to saying in a regular checkup. The heart attacks that kill people quietly, the ones that happen while someone is sleeping peacefully, those are almost never a surprise to the body. The body saw them coming. The warning signs were there. The triggers were there. They were just hiding inside habits that felt completely normal. A late dinner, a pill taken at the wrong time, a bedroom that was a little too warm. Things that seemed so ordinary, so harmless that nobody ever questioned them. I have been practicing cardiology for over 2 decades. I have sat with patients in recovery rooms and watched their faces when I explained what contributed to their cardiac event. And the reaction is almost always the same. Shock. Not because the information was complicated, but because it was so simple, so avoidable, so completely unknown to them until that moment. Tonight I want to share 5 of those patterns with you. 5 nighttime habits that are silently putting your heart under pressure while you sleep. And then I am going to walk you through exactly what to do instead, step by step, in a way that fits into your real life without any major disruption. If you are over 60, or if you love someone who is, please stay with me through this entire video. What you are about to hear could genuinely matter. Let me start by explaining something that most people over 60 have never been told about their own body at night. When you are young and healthy, your cardiovascular system does something remarkable every single evening. As you fall asleep, your blood pressure naturally drops, usually somewhere between 10 and 20% lower than it was during the day. Your heart rate eases down, your arteries relax, your body enters a kind of overnight maintenance mode, quietly repairing itself, restoring itself, preparing for the next day. This nightly dip is not just comfortable, it is protective. It gives the heart a genuine rest. It allows the arterial walls to recover from the pressure they absorbed all day. It is one of the reasons a full night of sleep has always been associated with better cardiovascular health. But here is what changes after 60. The blood vessels gradually lose some of their flexibility. The hormonal signals that used to trigger that protective nightly dip become less reliable. The nervous system's ability to precisely regulate blood pressure during sleep starts to weaken. And what you are left with is a cardiovascular system that is still running all night, still managing pressure and circulation and oxygen delivery, but doing it with fewer backup systems and much less room for error. During the day, your body can compensate. If something pushes your blood pressure up, other mechanisms push back. But at night, many of those compensating systems are essentially offline. Your body is doing its best with a reduced crew. And that is exactly why the hours between midnight and 6 in the morning carry the highest statistical risk of heart attack and stroke for people in this age group. Not the afternoon, not during exercise, the quiet hours, the sleeping hours. And what determines how safe or how dangerous those hours are for your heart? In large part, it is what you did before you closed your eyes. Let's start with the first habit. And this one catches almost everyone off guard because it feels so completely normal. What time did you eat dinner last night? And what was on your plate? I ask that question to every new patient I see. And for a significant number of people over 60, the answer is somewhere around 8 or 9 in the evening. Sometimes later. A real meal, pasta, a heavy protein, something fried, bread, maybe dessert, followed by the couch for an hour, then bed. Life gets busy. Schedules shift. For many families in America, a late dinner is just how things work. I understand that completely, but I also need you to understand what that late meal is doing inside your body, because the picture is not pretty. When you eat a large meal, your digestive system immediately begins demanding more blood flow. Significantly more. Your heart responds by pumping harder and faster to meet that demand. Your blood pressure rises. And within 2 to 4 hours of eating, your triglyceride levels, the fat circulating in your blood, spike sharply. Now add sleep on top of that. Your body is expecting the evening to be a gradual wind down. It is preparing to shift into recovery mode. Lower pressure, slower heart rate, reduced demand. But instead it is receiving the exact opposite signal. Full digestion is an all-hands-on-deck cardiovascular event. And your body is being asked to run that event and shift into nighttime recovery mode at the same time. Those two demands directly conflict with each other. And in a body over 60 where the arteries are already somewhat stiffer, where the pressure regulation is already less precise, that conflict is not just uncomfortable, it is measurably harmful. Research has consistently shown that eating a heavy meal within 2 to 3 hours of going to sleep is linked to elevated blood pressure during the night. more frequent episodes of acid reflux that can mimic and in some cases actually trigger cardiac symptoms, and a meaningfully higher risk of cardiovascular events occurring during sleep. The solution requires no special diet, no expensive changes, just a shift in timing. Finish your main meal by 6 or 7 in the evening. If you need something later, keep it light. A small amount of protein, some vegetables, nothing heavy, nothing fried. Give your heart the 3 to 4 hours it needs to settle before you ask it to do the work of sleeping. Now I want to talk about something that I consider one of the most preventable sources of cardiac risk in patients over 60. And it involves medication. If you take medication for high blood pressure, which statistically more than half of Americans over 60 do, I need you to pay very close attention to what I am about to say, because this is information that most people in your position have never received, even from their own doctors. Blood pressure in a healthy body follows a predictable rhythm through the day. It rises in the morning when you wake up and become active. It peaks somewhere in the early to mid-afternoon, and then it gradually falls as the evening comes, reaching its lowest point during sleep. But a significant portion of people over 60, particularly those who have been diagnosed with hypertension, do not follow this pattern. Their blood pressure does not fall at night the way it should. In some cases it barely dips at all. In other cases it actually rises during the overnight hours, spiking in the early morning when the body is most vulnerable. This condition is called nocturnal hypertension. And the reason it is so dangerous is not just that the pressure is high, it is when the pressure is high. During the day, your arterial walls are braced, your system is active. There is some degree of buffer, but during sleep, that buffer is gone. A pressure surge at 3 in the morning hits your arterial walls in a way that is far more likely to rupture a vulnerable plaque inside a coronary artery. Far more likely to trigger the kind of clot formation that ends with someone calling 911. Now here is the problem that millions of Americans are living with right now without knowing it. If you take your blood pressure medication only in the morning, it may be wearing off by the time night arrives. By midnight, by 2 in the morning, when your pressure is climbing and your arteries are at their most exposed, the medication that was supposed to protect you may no longer be doing its job. There is strong clinical evidence, including data from a large cardiovascular study examining medication timing, showing that taking blood pressure medication in the evening, rather than the morning, significantly reduces the risk of cardiovascular events during sleep. Not marginally, significantly. This is not a complicated fix. It is a 2-minute conversation with your doctor. Ask specifically whether your blood pressure medication should be moved to the evening. Ask whether your current dosing schedule is actually covering your most vulnerable hours. That conversation, which most people have never had, could be one of the most important medical discussions of your life. Please do not assume that because your doctor prescribed the morning dose, the timing has been carefully optimized for your individual risk. In many cases it has not been. Ask the question, push for the answer. The third habit is one that I take seriously in every patient over 60 who comes through my door. And most of the time when I bring it up, they have never thought of it as a cardiac issue at all. Do you snore? Has anyone ever told you that you stop breathing in your sleep, even briefly? Do you wake up in the morning feeling like you barely slept, even after 7 or 8 hours in bed? Do you get headaches when you first wake up? Do you find yourself waking up throughout the night feeling like you are gasping or choking? If any of those descriptions sound familiar, I need you to hear what I am about to say very carefully. Sleep apnea is one of the most underdiagnosed conditions in older Americans. Conservative estimates suggest that more than 30% of adults over 60 have some form of it, and the majority of those people have never been evaluated, never been diagnosed, and have absolutely no idea what is happening to their cardiovascular system every single night. Here is what actually occurs during a sleep apnea episode. You stop breathing. It might be for 10 seconds. It might be for 30 or 40 seconds. It can happen dozens of times in a single hour. Each time it happens, the oxygen level in your blood drops. Your brain recognizes this as an emergency and fires off a full stress response. Adrenaline floods your system. Your heart rate surges. Your blood pressure spikes. Your body essentially jolts itself awake to restart your breathing, and then you drift back down and it happens again. If you are experiencing 30 or 40 episodes like that every hour, your heart is absorbing 30 or 40 cardiovascular stress events every single night. Night after night, month after month, year after year. The cumulative damage to the cardiovascular system from untreated sleep apnea is not subtle. People with this condition carry roughly 3 times the normal risk of heart attack. They have significantly elevated rates of atrial fibrillation, which is an irregular heart rhythm that dramatically increases the risk of stroke. Their arterial walls thicken and stiffen faster than those of people without the condition. And because all of this is happening during sleep, because the person has no conscious awareness of it, it often goes completely unaddressed until something serious forces the issue. If you snore, if you wake up exhausted, if anyone has ever watched you sleep and noticed that your breathing stops, do not file that away as a minor inconvenience. Talk to your doctor about a sleep study. In many cases, it can now be done at home. The evaluation is simple. The treatment, most commonly a CPAP device that keeps your airway open during sleep, is highly effective. Patients who use it consistently show measurable drops in blood pressure, lower rates of heart rhythm problems, and meaningfully reduce cardiac risk overall. I know a CPAP machine is not anyone's idea of a comfortable or glamorous addition to the bedroom, but I have seen what untreated sleep apnea does over the long term. I will take the machine every single time. The fourth habit involves something that almost every older adult does for a completely logical reason. And that logic, unfortunately, is quietly putting their heart at risk. Many people over 60 deliberately stop drinking fluids after dinner, or even after late afternoon. The reasoning makes total sense. They want to sleep through the night without having to get up for the bathroom. Disrupted sleep is miserable. Falls during nighttime bathroom trips are genuinely dangerous for older adults. Limiting fluids in the evening feels like the smart, practical choice. I understand the thinking, but here is what that habit is doing to your cardiovascular system. When you go to bed even mildly dehydrated, your blood becomes thicker, more viscous. It does not move through your vessels as freely as it should. In a younger person with healthy, flexible arteries, that is a manageable inconvenience that the body handles without much trouble. In a person over 60 who may already have some degree of arterial narrowing or stiffness, it is a different situation entirely. Thick blood moving slowly through already compromised vessels is significantly more prone to clot formation. And now consider what happens during sleep. Your heart rate slows naturally. Blood moves through the system more slowly anyway. Your body is not moving, not generating the kind of circulation that comes with activity. You may be lying in the same position for 7 or 8 hours. Take all of those factors together. Dehydrated blood that is thicker than it should be, a slower heart rate, reduced circulation from lying still, arteries that may already be partially narrowed, and you have a set of conditions that explain, in significant part, why strokes and heart attacks cluster so heavily in the early morning hours. The fix here is genuinely simple, and it does not require you to drink a large amount of fluid. 1 full glass of water before bed, 8 ounces. That is enough to keep your blood from thickening unnecessarily overnight. Keep another glass on your nightstand. When you wake up at 2 or 3 in the morning with that mild sense of thirst, your body is telling you something your heart also needs. A few sips from that bedside glass takes 10 seconds and provides real protection. You do not have to choose between avoiding the bathroom and protecting your heart. Just be thoughtful about it. 1 glass, that is the whole ask. The fifth and final habit is one that genuinely surprises people when I bring it up, because it sounds almost too simple to be significant. But the data on this is clear, and the mechanism makes complete physiological sense once you understand it. What temperature is your bedroom at night? Most people have a preference. Some like it warm, some like a cool room. Very few have ever thought about it in terms of cardiac health. But your cardiovascular system has a specific range in which it operates most efficiently during sleep. And on either side of that range, your heart is working harder than it needs to. If your bedroom is too warm, above roughly 72 degrees Fahrenheit, your body spends the entire night trying to manage excess heat. Your blood vessels stay dilated, which sounds like it might be good, but in this context, it means your heart is working to maintain pressure across a wider, more demanding circulatory load. Your heart rate stays elevated rather than settling into the slower, more restful rhythm that supports overnight recovery. You sweat more, which accelerates the fluid loss we just discussed. And critically, your sleep quality drops. You spend less time in the deep slow-wave sleep stages where the heart does its best recovery work. If your bedroom is too cold, below about 65 degrees Fahrenheit, you get the opposite problem. Cold temperatures cause your blood vessels to constrict, tightening up to preserve core body heat. When vessels constrict, blood pressure rises. Your heart has to work against greater resistance with every single beat. For someone who already has some degree of coronary artery disease or hypertension, That sustained overnight pressure increase is a real and unnecessary stress on the system. The optimal range is between 65 and 72 degrees Fahrenheit. In that window, your body stays in what physiologists call thermoneutral territory. Vessels are relaxed but not overdilated. Heart rate settles to its natural resting level. Sleep quality is protected. Your heart gets the quiet, undisturbed overnight environment it needs to do its maintenance work. One thermostat setting, one adjustment, real protection. Now I want to step back from the list for a moment and tell you something that I think matters more than any individual tip I could give you. I have been in operating rooms at 3 in the morning working on hearts that failed overnight. I have spoken with families at dawn who had no idea anything was wrong when they said goodnight a few hours earlier. I have reviewed case after case where the contributing factors were not exotic or unpredictable. They were a dinner eaten too late, a blood pressure pill taken at the wrong time or skipped entirely, an airway that had been collapsing silently for years while everyone assumed the snoring was just snoring, a body that had quietly run out of water, a bedroom that was 10 degrees too warm. Ordinary things, unremarkable things. The kind of things that never make it into a conversation with a doctor because they do not feel like medical issues. But they are. And the accumulation of those small stresses, night after night, year after year, is one of the primary ways that cardiovascular disease progresses silently in people who believe they are basically fine. Most of the cardiac events I have seen over 2 decades of practice did not come out of nowhere. They came out of a long series of nights where the conditions were quietly working against the heart, and nobody knew to look. You now know to look. So here is what I want you to do with everything you just heard. Not next week. Tonight, aim to finish your main meal by 6 or 7 in the evening. If that is a significant change from your current routine, start by moving it 30 minutes earlier this week, and keep adjusting. Your heart will notice the difference. If you take medication for blood pressure, make a note right now to ask your doctor specifically about timing. Ask whether evening dosing might offer you better overnight protection. That single question could be the most valuable medical conversation you have this year. If you snore, if you wake up exhausted, if anyone has ever mentioned that your breathing sounds irregular during sleep, make an appointment for a sleep evaluation. This is not optional for someone over 60 who is serious about their heart health. Drink a glass of water before bed. Put one on your nightstand. Do not let something this simple be the thing your heart needed and did not get. Check your bedroom temperature. If you do not know what it is, find out tonight. Adjust it to somewhere in that 65 to 72 degree range and keep it there. And one final thing that costs you absolutely nothing. If you snore or have any history of sleep apnea, try sleeping on your side rather than your back. Sleeping on your back makes airway obstruction significantly worse. A simple change in position can reduce the number of apnea episodes you experience each night while you work toward getting a proper evaluation. These are not difficult changes. They are not expensive. They do not require a special diet or a gym membership or a prescription. They require awareness and a decision to act on what you now know. I have spent more than 20 years working on hearts that had already reached a crisis point. My hope in making this video is that fewer people end up in that situation. That more people over 60 spend their nights giving their heart what it actually needs, instead of unknowingly making its job harder. Take this seriously. Share it with someone you care about. And take care of that heart. It has been working every minute of every night your entire life. Give it the conditions it deserves. One important note before you go. Everything I have shared here is based on current cardiovascular research and my own clinical experience, and it is meant to inform and educate. It is not a substitute for the personal medical care of your own physician. Before you make any changes to your medication schedule in particular, please have that conversation with your own doctor first. That is not a formality. That is genuine advice from someone who wants you watching this channel for many years to come. Good night, sleep well, and starting tonight, give your heart a fighting chance.